Hello everyone, today we'll be talking about birth control and its impact on the heart. To start, what exactly is birth control? Birth control is a daily medication which contains important hormones that cause specific changes to the body. As a reminder, hormones are chemical substances that control the function of several different organs and assist in many bodily processes. Most birth control pills contain a mix of hormones, estrogen, and progesterone. Some pills may contain only estrogen and/or only progesterone. Birth control, as the name suggests, assists in preventing pregnancy. However, birth control pills are used for more than a form of contraception. For example, a healthcare professional may prescribe this medication for treating acne, menstrual cramps, bone thinning, ovarian cancer, and serious infections in one's ovaries, fallopian tubes, and/or uterus. It can also help to treat iron deficiency. Just to note, it's important to contact your healthcare provider for any questions regarding your own use of birth control. Furthermore, in 2019, it was reported that 842 million individuals identifying as females use contraception, and the most popular used method is birth control pills. Thus, it's imperative for women who may be dealing with heart-related issues to be aware of the impact birth control may or may not have on their heart health. In the next few slides, we will be discussing just that.
Some of the main effects of the hormones used in birth control on your cardiovascular system include increasing the risk of forming a blood clot, increasing your blood pressure, and altering your cholesterol levels. Blood clots can be a serious problem as they can block the flow of blood through the arteries that supply essential organs. The hormone estrogen in birth control pills is associated with higher rates of blood clot formation in the veins, in the legs, and in the lungs. These blood clots can sometimes detach themselves from the wall of the vessel in which they were formed and travel to other vessels where they can get lodged. When blocking the flow of blood to your heart, it can cause a heart attack, and when blood clots block arteries that supply blood to the brain, they can cause a stroke. While the use of birth control can increase your risks of blood clotting, for the average person, the risk of developing a blood clot is still very small. Only about 1 in 3,000 people on birth control will develop a blood clot every year. However, for individuals with risk factors that predispose them to having a stroke or a heart attack, the increased risk of blood clotting is significant enough for medical professionals to suggest alternative birth control options. For example, progesterone-only birth control methods have a lower risk of blood clots. Similarly, taking birth control can increase your risk of high blood pressure. This means that you should speak to your physician about what forms of birth control are best for you to use if you already have high blood pressure or if you have other risk factors for high blood pressure, including obesity, smoking, a family history of high blood pressure, low levels of physical activity, and a poor diet. Additionally, if you are taking birth control pills, it's advised to take your blood pressure regularly. Everyone should have a blood pressure machine at home. Some forms of birth control may also alter your cholesterol levels. For example, some birth control pills have been shown to decrease your levels of good cholesterol, also known as HDL, and increase your levels of bad cholesterol, also known as LDL. For most individuals, these changes are minute. However, it should be of note for you if you have high cholesterol or if you have a family history of high cholesterol. A common question about birth control is whether it will increase your weight. Generally speaking, research evidence shows no causal relationship between birth control use and weight gain. In some cases, people do report gaining weight in the few weeks after starting to use birth control. However, this extra weight is most often because of estrogen causing fluid retention and not added fat.
So now let's talk about birth control and heart disease. A common question is, does birth control cause heart disease? Well, to simply put it, birth control pills do not cause heart disease, but they do tend to increase blood pressure and other risk factors for heart disease. So women who have any form of cardiovascular or congenital heart disease or risk factors, such as age, obesity, uncontrolled hypertension, or are currently smoking, should not be taking hormone-based birth controls without first consulting their physician. And if you do take birth control pills, it's a good measure to get your blood pressure checked every 6 months just to make sure it stays within a healthy range.
It's highly recommended for women with heart conditions to involve a cardiologist or primary healthcare provider in selecting the appropriate contraception. Many factors must be considered before making this decision, including risks of pregnancy or termination and the relative risks and efficacy of the available contraceptive methods. For example, approximately 40% of women with dilated cardiomyopathy will experience at least one cardiac event during pregnancy, including pulmonary edema, arrhythmia, or stroke. Maternal deaths and stillbirths have also been reported in this group. This is why choosing the right type of contraception is crucial for patients with heart conditions.
And given the relative risks of pregnancy, sexually active patients with heart disease should be counseled regarding the use of the safest and most reliable methods of contraception. So these methods should be individualized based on the patient's clinical severity, lifestyles, values, and preferences. And for each cardiac condition, the choice of contraceptive method depends on cardiac risk associated with the method, the levels of contraceptive efficacy required, and as well as the patient's preferences.
Contraceptive methods are divided into 3 tiers of effectiveness based on their typical use failure rates. Tier 1 methods include permanent sterilization and long-acting reversible contraceptives. Intrauterine devices, which are IUDs and implants, are in this tier. There is a small risk of a vasovagal reaction during IUD placement, which may be poorly tolerated in patients with certain cardiovascular conditions, such as single ventricle palliation or severe pulmonary hypertension. However, this risk is substantially outweighed by the benefits of highly effective contraception. There is also permanent sterilization via tubal ligation or removal, which provides irreversible contraception and is a safe, cost-effective option for women who do not desire future pregnancies. Tier 1 contraceptive methods are safe and most effective for women with cardiovascular conditions. Tier 2 methods include combined hormonal contraceptives, which can have oral, transdermal, and transvaginal modes of delivery. These methods are commonly known as the pill, the patch, and the ring. Generally, most safety concerns are related to the increased risk of thromboembolism associated with estrogen-containing methods, whether that is the pill, patch, and ring. Notably, even though these methods pose an increased risk of thromboembolism to the patient, the risk remains substantially lower than the thromboembolic risk of pregnancy. But if there is significant risk of mortality related to thromboembolism, estrogen-containing methods are not recommended. While this risk should always be individualized to each unique patient's needs, there are several broad categories of cardiovascular conditions that are thought to pose an increased thromboembolic risk due to the use of hormonal contraception. This includes certain congenital heart conditions, valvular heart conditions, cardiomyopathies, vascular disorders, and arrhythmias, among others. While most healthcare providers would avoid prescribing hormonal contraceptives, especially those containing estrogen, progestin-only methods are not associated with an increased risk of thromboembolism and are considered safe in this patient group. Depending on the specifics of a case, hormonal contraceptives may or may not be safe for patients with cardiovascular conditions.
Now, moving on to some general recommendations, it's been cited that the most important link between birth control pills and heart disease involves age and other risk factors for heart disease. And the combination of age and smoking also presents such a strong risk that women who smoke and are over the age of 35 are recommended to not take combination birth control pills. Progesterone-only birth control pills may be appropriate for women over the age of 35 and who are smokers, but of course, again, it's always important to check with your doctor first. Combined hormonal contraceptives may increase blood pressure, and therefore it's also recommended that hypertension is well controlled before initiating a trial of hormonal contraceptive therapy, and it's closely monitored throughout the usage. There are certain hormonal contraceptives that you may want to avoid if you do have a heart disease. So if you have a heart condition that makes you more likely to develop blood clots, or you already do have high blood pressure, then the types of contraception that contain O-estrogen are less likely to be recommended to you by your doctor. And it's the thrombogenicity of estrogen of a combined hormonal contraceptives that makes that method unsuitable for many women with heart disease, and this is because estrogen increases the risk of both arterial and venous thrombosis.
Tier 3 methods include barrier methods, withdrawal, and natural family planning. Barrier methods, including male condoms, female condoms, and sponge or fertility awareness, do not carry any increased cardiovascular risk with use, but they are the least effective. Given the high risk of unplanned pregnancy when used alone, they're not recommended for standalone use in women with a high risk of serious morbidity or mortality related to pregnancy.
Thank you for listening. Also, if you enjoyed this video, have a look at the other short and long format videos on Dr. Curnew's YouTube channel on various topics.